Tom, thank you for being with us again to talk about COVID and the economy. Usually in these interviews, we ask you to be an economist. Today, we're going to ask you to play the role of an epidemiologist and help us understand and interpret some of the confusing health data that's out there right now that we're reading about in the headlines.
All right. Well, I'm looking forward to it. I never thought I'd be able to be an epidemiologist, so I'll give it a shot.
Let's bring up a couple of charts here that illustrate kind of the mixed signals that the health data is sending to all of us. One of the charts shows the new cases per day. That's showing things getting worse. They're up over 60,000. They've gotten significantly higher over the last several weeks. So that's number one. We have another chart that also shows fatalities by age cohort over time, and those have gotten much, much better. And I guess thinking about those two measures and then all the other measures that are out there, where would you say we are right now in terms of the public health situation?
We all have to recognize that our level of knowledge was effectively zero not so long ago. What we think we know now is more than zero, but there's still a lot more that we don't know. Based on my reading of history and other pandemics, my understanding of all the material that I've been voraciously reading about COVID-19, I'll borrow from Winston Churchill and say, this is not the beginning of the end, it's more like the end of the beginning, right? I don't know what this is going to look like a year from now, but I do take very seriously the words of informed epidemiologists and public health officials who know a lot more than me. So, for example, recently the head of the Centers for Disease Control said that the number of people who have COVID-19 in the country is probably about 10 times more than this data would tell you, because our testing has been so small relative to the total population that we're not measuring the true scale of the infections in the population. They have also said, the CDC, have also said that they expect that there will be a significant increase in cases during the fall and winter season when you would normally have flus and influenzas and all of those other things.
One piece of data is that the number of tests per day is much higher today that are being taken, is much higher now than it was in the early portions of the pandemic. That's not surprising. How much do you think the case count increases are being driven simply by the fact that more tests are being taken?
I think you don't find what you don't look for, right? You don't measure what you don't try to measure, right? And so we are trying and in fact achieving to measure the existence of cases more effectively over time by conducting more tests. We don't have a big enough data set, a comprehensive enough data set to actually know whether the number of cases is going up or going down. All we do know is that we're finding more because we're looking for them, right? And we know that this is a incredibly infectious disease, and that if we don't take the necessary public health measures to suppress it, it grows like weeds. It just spreads like crazy. I look at lots of things personally to understand the nature of things. I look at a graph that tells me the number of cases reported per day. I look at the number of tests. But I also look at other anecdotal things around how are we all behaving in different cities, states, and regions of the country. If you compare our results with the results of a number of countries around the world, or if you compare the results today of New York, Connecticut, and New Jersey versus some other states, the behavior of individuals and the guidance of political authorities and public health authorities in guiding the behavior of individuals has a dramatic, demonstrable impact on the spread of the virus.
Let's bring up the next chart, which shows fatalities to date by age cohort. And one of the unique attributes of this pandemic is that it does very disproportionately impact older people in terms of the severity of it. And I think something like 80% of the fatalities to date have occurred amongst people 65 or older. So what you have, I think, is a disease that where the health risks are borne by people who are not working, who are retired. The economic risks are borne by the working age population, people who are younger. I wonder if you could just talk about that dynamic and what it's meant so far.
That's a really interesting question, and I don't think a lot of people are really thinking about it. I think what our national leaders, our state leaders, the Congress, et cetera, what they're all thinking about is how to get us through the catastrophic economic consequences of COVID, keep people from, losing their jobs if we can, losing their homes if we can, losing health insurance if we can, all of that kind of stuff. If you step back from those details and look at this and contemplate it, here's what the challenge is. This is a significant additional intergenerational transfer friction point for this country. It pits the claims of the older part of the population against the claims of the working age and young population, because fewer and fewer working age and young people have to pay for more and more older age retired people and to pay and service more and more accumulated debt of the federal government and of the consolidated country. And just to put that in perspective, we are in a higher level of debt than we've been at any time in my lifetime. You have to go all the way back to World War II to find a time when we were more levered than we currently are. And so the unexpected consequence of this is going to be to pour additional salt into the wound of this intergenerational financial dilemma that we have, where the people who go into Medicare and Medicaid and all these things say, I worked all my life for this, you owe it to me. And the younger people are sitting there saying, yeah, but when you were in the workforce in your youth, you weren't paying anything like the giant pile of accumulated liabilities that we're having to pay for all of you because of the demographic shifts that are going on in the country as that giant cohort of baby boomers goes into retirement, and because our combination of our low intrinsic population growth and our design and our public policy goals at the moment to try and clamp down on immigration, that means the number of people entering the workforce is shrinking. And there's fewer and fewer people having to pay more and more money for more and more retired people. And this is accelerating that dramatically.
CoBank's just made the decision to begin return to the office in August. You made that decision personally. You had to make that decision with public health and epidemiology not really in your training or your wheelhouse. You're not alone in this. CEOs and boards around the country are doing the same thing. Just talk about what that's been like.
Well, the burden of leadership and the benefit of leadership, because it's a privilege to be able to carry the responsibilities of leadership that I do for our customers, for our mission, and for our 1,135 CoBank associates. You often get credit for things you didn't do. You get blamed for things you didn't do, and you often get asked to make decisions that are probably outside of your wheelhouse. And so, you have to bring to bear on any complicated and difficult decision that you have to make as a leader a combination of competencies and character. We're trying to do the right thing here. These are difficult challenges, and people are all having to make decisions about things that they never were trained to take decisions about, never thought they would have to take decisions about it. And probably in many cases, if you asked them privately, they'd say they really wish they didn't have to make decisions about. But that is the opportunity and the responsibility of leadership to do the right thing as best you can understand it, to balance all those risks and opportunities.